Hello, everyone. I'm Dr. Angela Mattke, and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota, and host of this show about pediatric health topics, where we take and answer your questions live. Because of COVID-19 and the safety measures we must all take to be safe, we're coming to you live today via Zoom to maintain social distancing. This past year has been a very challenging time for many of us. Both children and adults have had to face stressors and become adaptable in ways that we never imagined. Today, we're talking to you about how to foster resilience and emotional well-being in children and adolescents during this COVID-19 pandemic. Joining us for this discussion are two pediatric providers on the front lines in primary care. The first is Dr. Paige Partain, a pediatrician at Mayo Clinic Children's Center. She also completed a one-year fellowship in pediatric behavioral health through Boston Children's Hospital. Our second guest is Hannah Mulholland, a licensed independent clinical social worker in integrated behavioral health within primary care setting. Please send your questions today about the topic, and we'll try our best to review them during the live broadcast. However, we cannot offer specific medical advice for your family's circumstances. So, Dr. Partain and Hannah, thanks for coming back on the show. I'm really excited to have you here today.
Great to be here.
Absolutely.
I'm really selfishly chose this topic because I feel as a parent and just somebody who's trying to survive this pandemic, our family's been struggling too. And I've noticed my children, having more stress. I've noticed myself having more stress. And so I'm really hoping that you can help me and my family learn some ways that we can cope and build resiliency during this time.
Absolutely.
Yeah. So, all of us have been struggling because we've had these increased demands, more roles that we're trying to play during this pandemic, and different stressors that have come out. So, what are you telling families to help them cope with these stressors during this time?
I think the main thing that I'm focusing on is that we all need to change our expectations. And by change, I mean lower. This is not life as usual. And so it's not fair to expect that of ourselves or even our children. And it's okay to do things differently. It's okay to have negative feelings. It's okay to feel like you're just being driven crazy by each other at home. And we just need to lower what we expect from one another and what we expect from ourselves.
Do you have any specific tips for parents that are, trying to work and trying to do distance learning with their kids, or grandparents and other guardians that are really trying to help fill in the roles, and, we're all coming together as a community to help our children?
Yeah, I think what you said is so true. All of a sudden, we have so many roles that we're carrying as parents, and we were not trained for this. We were not equipped for this. We didn't want to all become educators. So it's really important to not try to be that super parent that can just do it all, is to recognize that it's okay that those are not comfortable for you roles. Those are not things you're going to be 100% in every single role that you take on. So make sure that you take your breaks, right, from your family, from your work, maintain schedules and routines. And the most important thing is to ask for and then accept help from others.
Yeah, accepting help is key, isn't it, Dr. Partain?
I totally agree. I think the biggest thing that I've been trying to emphasize to families when I'm seeing them in the office setting and these concerns and these struggles come up is to remember to be kind to yourself and to be kind to everyone at home, because this is totally uncharted territories. I've said to many families, there's certainly no manual for parenting, but very much so, there's absolutely no manual for parenting during a global pandemic. So we're all trying to navigate these uncharted territories together. And I think, as Hannah mentioned, it's really crucial that parents take care not just of their families, but of themselves, and recognize that this is really trying, and we need to be even more open to the idea of accepting help in new ways, or finding new ways to try and take care of ourselves during these times.
Mm-hmm. That's really interesting, accepting help that you're saying. What strategies would you recommend to preventing burnout? I feel like I've been on the cusp of it during this pandemic. And I know that many other families and people are struggling with this too.
I think the biggest thing is remembering that you're not alone, and then finding someone that you do feel like can really relate to the situation you're in. So the people that we maybe had the most in common with are not as much anymore. So finding someone that really relates well, and then finding a purpose for your day, your week, your month, a reason.
Yeah, I think finding the purpose is super crucial. And I've also tried to encourage families to find small joys. I think in the busyness of our lives pre-pandemic, those sorts of things would maybe get lost. And now that we're sitting in a different setting, it's easier to refocus on those little things that you can kind of be excited about or look forward to, whether it's, a special camp out at home with everybody after the workday or the school day is done, or, a fun movie night on mom and dad's bed at home, maybe something you wouldn't normally do, right? All of those kinds of special small joys, I think, are the things that are really going to get us through and keep us from burning out.
And when we start to focus like a lot on the negative things, we tend to feel some of these burnout symptoms more. So you're kind of saying pick smaller things and really focus on some of the positive aspects that you can control.
Absolutely.
Okay, excellent. So many children and teens that we're seeing in our office, they're just having so many increased feelings or different feelings during this pandemic. But when children start to talk about feelings, it can be really scary as a parent, and you start to worry that your child might be struggling with a mental health condition or a mental health disorder. How do you know when feelings are just feelings or they might be more? And what do you recommend for families when kids are discussing these feelings? How do you validate these feelings?
I'll go. So I think that, most kids, just like us as adults, just want to be heard, right?
Mhm.
Like we just want someone to listen. You come home and you tell your spouse about your terrible day, and then they go, well, you should have. And you're like, no, right? So it's not about, offering suggestions or fixing it. It's just giving permission to talk about it without judgment or necessarily reassuring that's going to be okay, because it doesn't feel like it's going to be okay.
Yeah, absolutely. And I think along those same lines, even just speaking to the fact with your kids about the fact that it's okay to have feelings. I very much expect it in this setting. I've joked with a few families. I'm asking everyone as they're coming in the office nowadays kind of how they're doing and how we're getting through things. And when I get the rare answer, like, everything's great, we're doing wonderful, I almost sort of question if they're not mentioning everything that's going on, because the reality is everyone is struggling with feelings. And so I think that it's helpful not only to help kids feel heard, just like Hannah said, but to help them know that that's okay and very much expected to have new feelings or maybe things that they've never experienced before.
What about, these kids start to have more feelings, right? And they're not just always feeling happy or feeling okay. How do we teach them to cope with these different or new feelings that sometimes can feel scary for them?
The best way to teach a coping skill is to model a coping skill. So how can you as the parent point out what you're doing to help you get through? So, I'm really stressed out. I'm going to go take some deep breaths or do a mindfulness activity. I just can't figure out how to make this work right now. And so I'm going to take a little break and come back to it in 5 minutes.
Yeah. I think we underestimate the power of our modeling abilities in terms of how much impact that can have on our kids.
So it's saying it out loud and modeling them. What about when parents are feeling like they are struggling with their coping skills? What should we tell parents to help them with some like basic coping skills that can help?
I think that we should tell parents that it's okay to take those few minutes and do a skill themselves, even if that means they're checking out, from feeling like a parent for 5 minutes or a worker or a teacher, that to just take that time and sort of decompress, do something nice for themselves, and then try to come back to it.
Okay. So, Dr. Partain, how do we know when these feelings could be a sign of a mental health disorder? It could be something more than just having feelings, which are okay, and we want to validate, like we talked about.
I think to me, the biggest indicator is going to be functioning. So we expect feelings. Feelings are normal. They're going to be changing a lot with everything that's going on. But when it gets to the level that the feelings are really starting to get in the way of day-to-day life, get in the way of being able to get up and get through your routine, being able to get through your schooling activities, getting in the way of, everyone's interactions at home, that's the point where I would encourage parents to stop and think, gosh, could this be something that's a little bit more?
What would be some examples of kind of specific symptoms of maybe depression or anxiety or some other mental health disorder?
That's a great question. I think we often, particularly for depression, almost everyone thinks about the idea of feeling sad or feeling down. And we'll often see that for kids or for teenagers. But I want to emphasize as well that one of the common things that we'll actually see, particularly for teenagers, is irritability. So, I'm hearing from a lot of families, everyone's getting a little bit stir crazy at home. And there's going to be some times when everybody at home gets on your nerves. We expect that. But particularly if you're noticing that your teenager is getting more irritable than you would expect, where everything seems to get on their nerves, or nothing seems to kind of satisfy them in terms of making them less frustrated, I encourage parents to think about the possibility of depression, because for a lot of teenagers, that's really the way that the symptoms can manifest. But if they're seeing other things like increasingly isolating from their friends or their family, seeming less interested in things, particularly things that they've previously really enjoyed. So there's a lot of, kids that don't enjoy distance learning. It's not the way that we expected schooling to go, right? So I'm not surprised if they say that they're not enjoying that. But if you have a child who used to really love reading or drawing or music, and you're finding that those are things that they don't seem as interested in, those would be warning signs to me in terms of their mood. And, there's been lots of changes for folks in terms of sleeping routines and eating routines in the setting of the pandemic. But if you notice major changes in terms of, trouble sleeping or sleeping what you feel like is an excessive amount, always feeling tired, or big changes in appetite, those are often things that can come along with mood changes as well.
What about kind of anxiety related symptoms? What would you look for for those when we would be concerned, besides like the impairment of the functioning of a child? What specific anxiety symptoms would be helpful?
I think the things that stick out to me the most are sort of the voicing of symptoms, which every kid's a little different. Not all kids and teens like to talk about what they're worried about. But if you find that your child or your teen is bringing a lot of questions and worries to you, how are we going to know that's okay? What's going on? What's going to happen? These kinds of things, that to me is a sign of increasing worries or anxiety. Also kind of changes in their activities, meaning I've seen a lot of teens that are feeling worried about going out or doing things that they previously would have been comfortable doing because of the pandemic. And so if you as a parent are noticing, gosh, she doesn't want to go, out for a walk with the family, or she doesn't want to go to the store with me, even wearing a mask, that might be a sign that the anxiety levels are increasing to a point where they're really starting to kind of get in the way. I've also seen an increase in kind of even fidgeting like behaviors. So, more kids who are finding that they're having trouble with kind of sitting still and getting through their distance learning day, or finding, that they're doing a little bit more nail biting or picking or other things like that. And those can sometimes be sort of markers of anxiety levels too.
One other topic that I want to touch base on so families can recognize warning symptoms are signs of eating disorders. So Dr. Partain and I do a lot of eating disorder work, and Hannah helps us in our team as well with this. And we've seen a lot of kids struggling with development of eating disorders during this time. So what would be some symptoms for them to watch out for?
I think the biggest one that I would emphasize to folks is skipping meals. I know that structure of the day has really changed and routines have really changed, but what we're seeing for a lot of the patients who are coming in and getting diagnosed with eating disorders is just this sort of gradual trend toward missing meals. So maybe it was a kid who was really busy who had missed breakfast here and there previously, and now in the pandemic, they're finding when they're at home working through their distance learning, often they miss lunch, or they're not getting any snacks, or they're not eating until 7 or 8 o'clock at night when the family sits down to have dinner together after a work day. So I think skipping of meals is a really crucial thing. Or if you're finding even that they're telling you like, I'm not hungry or I'm not interested in food, those are big things that stick out to me. I'm trying, any other thoughts that you have, Hannah, on things that you've seen?
Yeah, I think disinterest in food is a huge one. Like the things that normally would have tasted really good, I don't want. I don't crave.
Okay.
Yeah.
Those are great tips. Okay, so let's move on. So families think that these feelings are more significant and may represent an actual underlying disorder. What should they do? What should be their next steps?
I think there's a few different places that you could start, but I would encourage you to even think about just reaching out to your child's medical provider to get them in for an assessment, because for a lot of these things, there's overlap. in terms of mental health conditions and medical conditions. And so it's helpful to start there and give a little more information to your child's doctor or provider to see what they think might be going on, and then help guide you in terms of next steps.
Great. So we have some really great audience questions about how we support. We've been talking a little bit here about what we see more in teens and kind of older kids, but I want to focus on a little bit about toddlers and kids with special needs. So what would you recommend maybe a toddler who feels the impact of the stress but doesn't really understand what's going on? And how would you recommend families support them during this time? And then the second question is about what about a child with autism or a neurotypical child? How it's hard to really know necessarily what they're feeling. So how do we support these kids during this time?
I think offering age-appropriate education is crucial, like making sure that you are talking to them about what's going on in a way that they're going to understand. Even out there, are great things called social stories that help kids understand and do it in a simple way with pictures about why we wear masks and why we, stand 6 feet apart, or funny pictures about what is 6 feet apart. My favorite one is like the front and the back of a cow. Like every kid loves that. So I think things like that get at the age appropriateness. But allow them to have that information because they sense something's going on for sure.
Perfect. And those younger toddlers and stuff, anything to decrease the impact of the stress that they might be feeling going on just from the stress that the family's experiencing?
As much as you can, minimizing change. Again, that is really hard to do right now if your daycare closes unexpectedly or you have to quarantine when you weren't. Things like that can be very hard. But if there's a way to minimize changes and keep routine, that's really helpful.
Okay. Perfect. Well, let's move on to talking about resilience, because I know that this is something that I so hope that my children are developing during this time and are developing, throughout their lifetime. How do we foster the resilience of our children and our adolescents during this time?
I think the most important thing is to feel okay with your child struggling. Meaning we as parents have this natural instinct to want to take away all the hurt or the pain or the anxiety, right? When our child comes to us or is crying or is upset. And a lot of times there's things that we can do to help them, but particularly in situations where there's things that are outside of our control, helping them understand that it's okay to feel upset. It's okay to be struggling. I find a lot of kids struggle even more because they feel like they shouldn't feel something, meaning they feel upset or they feel sad, and then they feel bad that they feel sad, or they feel bad that they feel worried. And what we can do to help foster their resilience is just let them know that's okay. That's a really normal thing, and sort of help model for them the fact that we're doing things to try to help get through this. Particularly thinking about like coping skills and these other things. And even as a parent, modeling the fact that sometimes I have a hard time. Sometimes I struggle. Sometimes mommy needs a 5-minute break, and that's okay for kids. And I think it's really helpful in teaching them that that's a part of growing stronger in life and growing stronger with challenges.
Hannah, do you have anything to add to that?
No, I think that's a great response. I agree.
One of my favorite phrases that I've started using even with myself is that I can do hard things. And saying to my kids that they get sick of me saying this all the time, but I'm hoping it's putting a little seed of resilience in them to know that when things are hard, you can still do them, even though they feel really, really challenging at that time. Yeah. All right. So as a parent, I also feel that sometimes I'm struggling to keep my kids busy at home. And so what are some activities that we can use to keep kids busy while they're spending so much more time at home than they would have spent in any other time?
I mean, the best is if there's any way to get outside, even if it's for a short amount of time, to do something, anything outside. I realize, we're up in Minnesota with the weather here, and that's not as friendly to that, but, or anything that involves movement, are you doing yoga together or running up and down the stairs, things like that keep you moving and out of that stationary position. Giving yourself something to look forward to. So what are we going to plan that we're going to do this weekend that we can keep looking forward to? How can we be creative? Go on things like car dates to different places, tours in your car. How can we set up scavenger hunts for our kids inside or outside? And then one that we don't often think about but can be super helpful is finding ways to give back, finding ways to think about others and put them forward, because we're all kind of stuck in our own little bubbles now, and it's not as intuitive to think about outside that bubble, especially for a child who wouldn't normally think about it anyway. So finding opportunities to give back.
Why is it so important that kids learn the value of giving back to others?
So it's actually one of the hugest factors in building resiliency is a child's ability to understand how they impact the world and impact others. It also creates a great sense of connection to
Mhm.
others, and builds on your values, whatever your value is as a family unit. It can help build on that. My favorite is care packages. Kids can love putting together a care package and dropping it on someone's porch, especially if they know the family, oh, I know they like this, and that can be fun.
You guys just gave me two wonderful ideas for this weekend. Scavenger hunt and care packages are on my agenda. That's great. So, as the months of this pandemic has continued to go on and on and on, why are schedules and routines so important, that we maintain them during this time?
So chaos equals stress. At the bottom line, the more you don't know where you're going and when, the more stressed you feel. So routine to children especially is safe and comforting. They know what's coming and when, especially for kids that might be on that anxious side of things. It's important that they know what's coming next.
I think that's especially important too. There was a great question from the audience about children with developmental disabilities, or maybe children that aren't neurotypical, maybe a child with autism. I think the schedule becomes even more important in that setting. And I'll often encourage families to not just go through like a verbal schedule with the child, like here's what we're doing for the day, but sometimes even having a visual cue can be really helpful. A sheet of paper or a poster that hangs on the wall that says, here's our daily schedule. We get up and we go through our morning routine and we brush our teeth and then we get dressed and all these things, because it becomes really easy. And
I think we lost Dr. Partain there. But it can be really easy for kids to not know what to expect if we don't have those visual cues for them to help follow. And I would just add in that, sometimes we'll have really good intentions and we'll create routines and checklists and things like that. And then it kind of just goes by the wayside. And like we said at the beginning of the show, it's okay to just not be able to do everything, and to be kind to yourself and forgiving. And so just kind of get back on board with it. If you've fallen off your schedule and your routines, there's no time like the present to just make a plan and decide a date and stick to it. Dr. Partain, you're back. Well,
yes,
you want to finish up what you were saying?
I think you nicely actually summarized exactly what I was trying to get at.
Okay, sounds good. So Hannah, do you have any ideas of other ways that we can kind of help improve schedules? Is there like some little pearls that I can take and use with my family?
Your basics are your waking, sleeping, and eating. So if you
Okay.
can just get those the same time every day, that's really good. Next step would be getting school class and homework time at the same time every day, if possible, and then doing more of a consistent time of how much screen time, like a school day versus a non-school day. For your kids, like Dr. Partain said, using a timer if they don't really understand time, or writing it out on a schedule with pictures, that can be helpful.
I love that. All right, how do we use these kind of pearls to help with distance learning that families may be doing at home?
So the biggest thing I'm hearing from students, is that they're all trying to do school in their bed. So
Yes.
every time I'm like, get out of your bed. I'm not allowed to work from my bed. Go to a desk, go to a table. Your bed needs to be associated with sleep and nothing else. So think about the environment they're trying to learn in, and encourage movement breaks, strong communication with the school. I even have a kid that we came up with the idea it's much better to use your computer than your phone, because your phone you can sort of like fall back. But if you have to purposely log in on your computer, that takes 5 minutes. It wakes you up. So just thinking about little things like that help kids. But know that pretty much every child is telling us right now, I can't focus and I have no motivation. And that's because distance learning is really hard. It's really hard.
Mm-hmm. Yeah, definitely. We have a great audience question that kind of gets at this topic of the kids being in their bedroom the whole day. So they're sitting on their bed. When they have video visits with us in the clinic, they're on their bed. And, they're talking to their friends on their bed. They're listening to music on their bed. And this audience question is about, when is it okay for them to socially isolate, especially if they're kids who enjoy isolation and don't like mingling with others? And, do we need to challenge kind of this natural inclination of these kids to want to be more socially isolated?
I'd say there's definitely a happy medium. If they do need some downtime, I'm going to go after the sleep thing, is that it still shouldn't be in their bed, because that really does mess with your sleep schedule, to confuse your brain about what activities happen in a bed. Am I social when I'm in there, or am I sleeping? So if they want to have their downtime, maybe create a fluffy, warm spot in their room where they can hang out and do that. And then set time limits on it. You can do this for this amount of time and then come out and eat with us, and then come out and do one activity with us, so that you are creating intentional times to interact with others, but allowing them that time if they do tend to get their fill on being alone.
Perfect. And, how do we decide how do we weigh kind of social distancing versus the emotional connections that are beneficial that we get when we are having connections with other people? And how do we do this safely during this time?
Oh, that's such a hard question.
Hmm.
And I get it on a daily basis. I think at the end of the day, the answer is probably different for every family. I think you have to weigh your own child's health, the health of everyone in your household. As vaccines are rolling out, vaccination status is probably something that will contribute some to your thought processes. But what I like to tell families is to try to really optimize everything that we know of that can give us social connectedness that's completely safe. So that's, FaceTime or video calls or Zoom calls. That's, for some kids, online gaming. Always want to have a conversation with them about kind of the type of game that they're playing and the people that they're connecting with. But I'm finding a lot of teens in particular that like to play online games, and that's a way that they can chat with their friends. And as long as their parents are aware with who they're talking to and the type of game that they're playing, that's one way that they can safely stay connected to their friends. But also thinking about things like virtual game nights or even the good old fashioned telephone call,
Mhm.
which
Most teens don't know what that is.
not as many teens are as familiar with as our generation, but thinking about setting those, like kind of set a phone rendezvous with a friend and just make it a time to connect or to catch up. I'm also finding that I'm getting a lot of questions about social media, because that's one way that people think about staying connected, and it's certainly a way that can safely help us feel connected. But I'm trying to caution families to be careful and judicious about time on social media, in particular because there's pretty good medical research that suggests to us that excessive amounts of time or increasing amounts of time on social media can actually be really harmful to our mental health, rather than being helpful. So I think short snippets of time, closely monitored kind of online activities can sometimes help. And then if you're thinking about trying to get outside of the virtual realm, I think you just have to consider your own family's kind of health and safety, and the sort of patterns and the health of those who you're thinking about connecting with. I think, there's lots of activities or things that you can do with a friend who's masked. It's not everyone's favorite thing to wear a mask everywhere that they go, but if it's something like, wearing a mask and getting out and going for a walk with your friend, even if you walk 6 feet apart
Mhm.
while you're out and on a walk, there are ways that we can try to maintain that feeling of real personal connection, but trying to also kind of maintain safety.
So teenagers are in a literal spot of brain development where novelty is super important to them, right? Something new and different. So challenge them to say, come up with an idea of
Mm,
what you could do to interact with a friend that I haven't thought of, and I'll consider it. Push
Mhm.
them to get
I
creative.
love that. I love that idea. Well, as we kind of end our time, do you have any closing kind of thoughts or recommendations for families um, as they just navigate this challenging time?
I just want to say that all of these are, great ideas, but so hard to implement right now. So the
Hmm.
bottom line is just grace for yourself and grace for others. This is a rough time.
Mhm.
Yeah, absolutely. Hang in there. And I think try to find your small victories, or the things that are going well, or that you are enjoying, that we've been able to kind of take out of all of these struggles.
Yeah, absolutely. Well, thank you, Hannah, and thank you, Dr. Partain, for joining us today. This was great. I feel like I have some tools to bring back to my family and implement for the weekend. Hopefully, implement as you mentioned with grace. You can catch the next Ask the Mayo Mom video question and live session, which will be on Thursday, February 4th at 11 a.m. Central Standard Time. We're going to be talking about sports participation during the COVID-19 pandemic and what kind of evaluation is needed before your child returns to sports participation after they've had a COVID-19 infection. So, joining us for this discussion are two experts who've been crafting guidelines in this area. The first is Dr. Dave Soma, a pediatrician and sports medicine physician, and the second is Dr. Tala Niaz, who is a pediatric cardiologist. Thank you, everyone who watched and sent in questions. If we didn't have a chance to review them all, we'll try to get to them after the live broadcast. Have a great day. Remember to be safe and remember to get your COVID vaccine when it's available to you. Have a great day.